Hey class, I hope everyone's doing well today. My name is Hunter, and I'm looking forward to reading your guys' speeches when I'm finished with mine. I'm going to be telling you guys about the benefits of marijuana and psychedelic mushrooms today. The three things I'll be focusing on is first off the negative stigma, and how the negative stigma that hovers over both substances may prevent people from seeking help and getting the things that they need. Second, I'm going to be speaking of the benefits of marijuana, and third, the benefits of psychedelic mushrooms, and some studies that back up the evidence as well. So why this negative stigma needs to change is, well, when people are scared of something or fearful or told bad things, they're probably not going to go and try them, even if it may help them. You never know until you try, and in this case, according to Lake Forest College, due to the psychoactive properties of both of these drugs, people are perceived as criminals, such as stealing and murdering and raping other individuals, which are all terrible and obscene things. But that doesn't all stem from this. It's like, if you do something, it's not what you do it with. It's you're the one who made the bad decision. Picking up what I'm putting down. But this can change by exploring the benefits of both substances. So here are a couple benefits of marijuana. According to the National Library of Medicine, an average reported pain relief from the medical cannabis was substantial. Pre-treatment pain, like if somebody asked you, hey, are you sick? Okay, how sick are you feeling on a scale of 1 to 10? So the average of these people who had pain that they were testing on had a 7.8. Well, after using the marijuana, it got down to a 2.8. That's a difference of 5 points. That's half the pain was gone in most of these patients. So it's a 64% average relative decrease in pain. That's a lot. It's a lot of pain relief. With anxiety and stress, the National Library of Medicine also acknowledges that the relief from stress and anxiety was 50% of users. People who couldn't sleep, it helped 45% of them, improved appetite in 12%, decreased nausea in 10%, and increased focus and concentration in 9%. With the benefits of mushrooms, the mental health and anxiety also stays true. However, with both marijuana and psychedelic mushrooms, something beautiful about these two things that scientists, and as more research begins to develop and get funding for and underway, is that substances such as opioids are becoming, more and more outlawed the more that people take these things. So it helps with substance abuse, smoking, people who have, tobacco addictions and nicotine addictions, alcohol abuse. The more that they use marijuana or mushrooms, these researchers, according to New York University Health Department, are noticing that people are having a decrease and are being able to go cold turkey from some of these substances. And the reason being is because specifically in psilocybin, which is like THC in marijuana, it's the active ingredient which, gives you the psychedelic effect. It acts by stimulating nerve cell growth in the part of the brain, and it stimulates neurogenesis. So it's in the part of the brain called the hippocampus, which is the brain center for emotion and memory. This also helps war veterans with PTSD. They may not be able to sleep and they have a traumatic experience. Well, if your brain becomes to get rewired, and it's like training a dog. If something has a traumatic experience, but they get shown that it's okay and you can have a different perspective on it, you tend to look at life a little bit differently in a more positive light and manner. And that is why I believe that the negative stigma surrounding both of these substances could be worked on, could be changed, so more people can experience relief from the poor things that they deal with each day. So overall, class, this is my story about the benefits of marijuana, psychedelic mushrooms. And the three things I communicated to you guys were the negative stigma, why it should be changed in order to help more people, and the benefits of both substances. I look forward to hearing your guys' speeches and doing peer reviews. I hope everyone's been well, safe, and blessed. Have a great day.